In the middle of this pandemic, we're calling healthcare workers heroes, essential, on the front lines. They're putting not only their own safety, but the safety of their families at risk every day by going to work. So you might be surprised to hear this. Some hospital workers are getting furloughed or getting their hours cut, including right here in Tampa Bay. Yeah, during a healthcare crisis. Huh? Let's find out why this is happening. Let's see what's brewing. I'm Jenna Bourne, and I'm an investigative reporter at 10 News in Tampa Bay. If you're new here, welcome to our caffeine-fueled deep dive into the issues affecting you during the COVID-19 pandemic. So you've probably seen it on your social feed, all the thank yous to hospital workers, free meals, salutes from firefighters, the whole 9 yards. I want to introduce you to GENIECE Hunt to talk to you about what you don't see on social media.
We're heroes, but we're also victims at the same time.
She's a registered nurse at Doctors Hospital of Sarasota, run by HCA Healthcare. Have you been furloughed yourself?
Yes, as a matter of fact, today I am off today because of low volume.
She says when she is at work, it's a skeleton crew.
And a lot of people are getting, hurt pay-wise.
A spokesperson for HCA tells me employees there who get their hours cut are eligible for a pandemic pay program that keeps paying 70% of their base salary. Now let's answer the first big question. Why the heck are hospitals telling healthcare workers to stay home during the biggest health crisis of our lifetime? The bottom line? Hospitals are getting fewer patients. Tampa General Hospital, Sarasota Memorial Hospital, and Lakeland Regional Health all say their emergency rooms have experienced about a 50% drop in patients over the past month or so. But wait a minute, with COVID-19 cases spiking, why do we have so many open hospital beds? Multiple hospitals in Tampa Bay say it's because some people aren't seeking medical help, even during emergencies, because they're afraid of getting COVID-19 if they go to the hospital.
Young people in their 40s who sit at home with chest pain, refusing to come in because they are worried that they will get infected with COVID, having heart attacks, and essentially die at home or come to the emergency department in a code type status.
Plus, elective surgeries that aren't urgent, are getting postponed. Fewer patients means less profit.
Healthcare is a business. I know people don't like to see it that way, but it is a business, and like any other business, if there's no revenue, then there's no way to pay bills.
So how do you cut costs while spending more money on things like personal protective equipment? The answer for many hospitals? Furloughing workers and cutting back their hours. Sarasota Memorial has been furloughing workers since the beginning of April.
We're continuing to pay everyone's benefits. While they're furloughed, we've given people extra PTO time to be able to fall back on.
Tampa General says it decreased its staff by 15%, far less than the 40 to 60% decrease in patients, because that means the hospital can still respond quickly if that patient volume increases. A spokesperson there also says, "We hoped it would help potentially expose less of our staff to potentially positive patients, so those employees can step in if others get infected." Baycare, which is the largest nonprofit healthcare provider in West Central Florida, says they have not furloughed their workers or cut pay. They've been reassigning employees to other areas that need more help, like operating room nurses working at community screening sites instead. Okay, so how do we solve this problem? Let's start by tackling this question. Should you be afraid to go to the emergency room? Hospitals tell us they're taking steps to keep you safe when you walk through the door. At Lakeland Regional, patients with symptoms or risk factors for COVID-19 go to one area, and patients who aren't showing signs of infection go to another.
We have gone so far as to map out our air conditioning units, our air handlers, where our ductwork sits, so that patients who are at risk for COVID breathe different air than patients who are not at risk for COVID.
And Florida hospitals may soon start seeing some lost revenue flowing back in. Governor Ron DeSantis announced this week that elective surgeries can start up again Monday, a huge moneymaker for hospitals. We'll keep an eye on how things are progressing to keep our healthcare workers working. If there's a topic you think we should cover, send us a tip at turnto10@WTSP.com. Stick around for more homemade deep dives into COVID-19 on What's Brewing. Subscribe to our channel so you don't miss an episode, and I'll see you next time. Mocha, I'm really trying to do a thing here. You don't care. You don't care.